Hey, let's do an Nclex practice question together. All these questions are from my free test bank. You can sign up for it in the link in my bio or on my website. So let's read the question together. We have a registered nurse who usually works in a spinal rehab unit and is floated to the ER. Which of these patients should the charge nurse assign to the RN? This is a prioritization question, management of care. Who do we have? We have a middle-aged client who said, I took too many diet pills. My heart's racing out of my chest. A young person who says, I hear songs from heaven. I need money for beer. I quit drinking 2 days ago. Why are my arms and legs jerking? And then an adolescent who's been on pain meds for cancer. Initial assessment is reactive pupils and a relaxed respiratory rate of 11. The bottom is an elderly client who reports taking a large crack hit and a fall 10 minutes ago. I would choose C. Why? Let's talk about the rationale. Because once you have somebody floating to another unit, you want to give them the patient who has the least minimal anticipated immediate complications, who essentially is the most stable. Hope this helps. Sign up for my free test bank.